Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Phenytoin. Its brand name is Dilantin. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Phenytoin. We'll then discuss examples of dosing and finish it off with side effects. I put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Phenytoin is an anti-epileptic drug that possibly enhances sodium efflux from neurons of the motor cortex. This cellular event tends to stabilize the threshold against hyperexcitability that results from excessive stimulation or environmental changes capable of reducing the membrane sodium gradient. In terms of indications or reasons we prescribe this medication to a patient, well, we may see Phenytoin prescribed for the treatment of a seizure during and following neurosurgery. This can be for treatment or prophylaxis, as well as it can be used for the treatment of generalized tonic-clonic and complex partial seizures. With respect to contraindications or reasons we would not be able to prescribe Phenytoin, well, first of all, we wouldn't give this medication to a patient who had a hypersensitivity to Phenytoin or to any other component of the formulation. As well, if a patient had a history of prior acute hepatotoxicity attributable to Phenytoin, they would also not use it again. Now for some examples of dosing with Phenytoin. So in the treatment of a seizure during or following neurosurgery, we may see 100 milligrams or 2 tablets given orally 3 times daily. The usual maintenance dose would be 300 to 400 milligrams per day, and the maximum dose would be 600 milligrams per day. For the treatment of a generalized tonic-clonic and complex partial seizure, we may see an initial dose of 100 milligrams orally 3 times daily, and the patient may adjust the dose every 7 to 10 days as necessary. Again, the maximum dose here would be 600 milligrams per day. As with all medications, there are some side effects or adverse reactions that patients may experience while using Phenytoin, so we'll go over some of those here now. 5 to 10% of patients may experience a rash, while some patients may experience constipation or gingival enlargement, as well as nausea and vomiting. Coordination problems may occur in some patients, as well as slurred speech, confusion, or a feeling of nervousness. The more serious side effects may include cardiac arrest, suicidal thoughts, or nephrotoxicity. Alright everybody, that's all we're going to talk about today with Phenytoin or Dilantin. As always, I'm very thankful you took the time to come and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description. You can check it as well. That's it for today. Take care.